Heart failure is a chronic condition where the heart can't pump enough blood to meet the body's needs. Heart failure develops over time as the heart's pumping action grows weaker. Right side heart failure occurs if the heart can't pump enough blood to the lungs to pick up oxygen. Left side heart failure occurs if the heart can't pump enough oxygen-rich blood to the rest of the body. Left-sided heart failure or left ventricular failure has different manifestations compared to right-sided heart failure. Pulmonary congestion occurs when the left ventricle cannot effectively pump blood out of the ventricle into the aorta and the systemic circulation. Pulmonary venous blood volume and pressure increase, forcing fluid from the pulmonary capillaries into the pulmonary tissues and alveoli, causing pulmonary interstitial edema and impaired gas exchange. Right-sided heart failure. When the right ventricle fails, congestion in the peripheral tissues and the viscera predominates. The right side of the heart cannot eject blood and cannot accommodate all the blood that normally returns to it from the venous circulation. Increased venous pressure leads to jugular venous distension and increased capillary hydrostatic pressure throughout the venous system. Pathophysiology. Heart failure results from a variety of cardiovascular conditions, including chronic hypertension, coronary artery disease, and valvular disease. As heart failure develops, the body activates compensatory mechanisms. The sympathetic nervous system is stimulated to release epinephrine and norepinephrine. A decrease in renal perfusion causes renin release and then promotes the formation of angiotensin I. Angiotensin I is converted to angiotensin II by angiotensin-converting enzyme, which constricts the blood vessels and stimulates aldosterone release that causes sodium and fluid retention. There is a reduction in the contractility of the muscle fibers of the heart as the workload increases. Compensation. The heart compensates for the increased workload by increasing the thickness of the heart muscle. Risk factors. Modifiable risk factors include hypertension, hyperlipidemia, coronary artery disease, obesity, smoking, and diabetes mellitus. Non-modifiable risk factors. Age. Increases with age, cardiomyopathy, rheumatic heart disease, and valvular heart disease. Assessment and diagnosis. ECG may show dysrhythmias. A chest X-ray may show cardiomegaly and ventricular aneurysm. Sonograms including echocardiography, Doppler, and transesophageal echocardiography may reveal chamber dimensions, valvular function and structure, and ventricular dilation and dysfunction. A heart scan or MUGA measures cardiac volume, ejection fraction, and wall motion. Exercise or pharmacological stress myocardial perfusion determines the presence of myocardial ischemia and wall motion abnormalities. PET scan is a sensitive test for evaluating myocardial ischemia and viability. A positron emission tomography (PET scan) is an imaging test that uses radioactive material to diagnose a variety of diseases such as tumors, heart disease, brain disorders. Cardiac catheterization assesses pressures, differentiates right versus left-sided heart failure, and evaluates coronary artery patency. Liver enzymes may be elevated in liver congestion or failure. Digoxin and other cardiac drug levels determine the therapeutic range. Bleeding and clotting times identify clotting risks and therapeutic range. Electrolytes may be altered due to fluid shifts, renal function, or diuretic therapy. Pulse oximetry measures oxygen saturation, especially in conjunction with COPD or chronic heart failure. Arterial blood gases or ABGs reflect respiratory and acid-base status. Bone and creatinine evaluate renal perfusion and function. Serum albumin and transferrin indicate protein intake and liver function. A complete blood count or CBC assesses for anemia, polycythemia, and dilutional changes. ESR evaluates acute inflammatory reaction. Thyroid studies determine thyroid activity as a potential precipitator of heart failure. Management of heart failure can be classified into several categories. There's pharmacological management, non-pharmacological management, nursing management, and palliative care. Non-pharmacological management includes a variety of lifestyle and supportive measures. Bed rest in a propped-up position or high Fowler's is recommended. Consuming small but frequent meals can help manage symptoms. Moderate sodium restriction around 2 to 4 grams per day is advised. Smoking cessation is crucial, and avoiding alcohol intake is also recommended. Nursing management aims to achieve several key objectives. These include improving cardiac output, enhancing gas exchange, restoring fluid volume balance, and improving activity tolerance. Additionally, supporting patients who are experiencing hopelessness is vital. Finally, educating the patient and their family regarding care is an essential part of nursing management. Palliative care. Fatigue and breathlessness are common problems at the end of life. Other symptoms may include tightness in the chest, feeling as if you are not getting enough air, or even feeling like you're being smothered. Family or caregivers can help by encouraging the person to sit upright, increasing the airflow in a room by using a fan or opening a window, and helping the person relax and not panic. Health education. Smoking cessation. Discuss weight monitoring. Check legs, ankles, and feet for swelling daily. Eat a healthy diet. Restrict salt in your diet and limit water. Maintain a healthy weight. Limit fats and cholesterol. Limit alcohol and fluids. Lead an active lifestyle. Reduce stress and get proper sleep. Complications, kidney damage or failure, heart valve problems, ascites and peripheral edema, also known as anasarca, heart rhythm problems, liver damage. Thank you all for watching this video. We truly appreciate your time and dedication as you prepare for your NCLEX journey. Remember, success comes with the right guidance and preparation, and we're here to support you every step of the way. If you're looking for expert coaching, whether online or live, visit www.brispainternational.com to register for top quality NCLEX coaching. You'll also find valuable IELTS guidance to help you reach your goals. Stay focused, keep pushing forward, and believe in yourself. You've got this.